Well, when some think of hitting the gym and pumping iron, images of bodybuilders comes to mind, but it turns out lifting weights should be a part of every well-rounded fitness regimen, especially of those of us who are a little older and also a little wiser. Here to tell us more is Dr. Willey from Physicians Immediate Care.
How's the older, not the wiser part?
Well, first off, tell us a little bit about the benefits of weightlifting and how that kind of applies, to everyone as a whole.
Oh, absolutely. Weightlifting has always been kind of classified as the meathead sport. You're a large football player, you're a bodybuilder, and cardiovascular activity has always been put to the forefront for medical reasons. Cardiovascular fitness, lowering heart disease, lowering stroke risk, etc. We're seeing now through some just excellent research, what a lot of us meatheads have known for years, that weightlifting actually has the same benefits cardiorespiratory wise, burns just as much fat, improves cognition, and UCLA just came out with a study this last week that showed that older people that have greater degrees of muscle mass have much less chance of premature death, and their longevity is greater. So really on a push again for weightlifting, for people to get out there and do resistance training. It protects your bones, protects your heart, decreases falls, and now we know it actually expands your lifespan.
Okay. So with that, when you mention, muscle mass and things like that, that's not necessarily, you have arms the size of tree trunks. You're not Schwarzenegger.
Right.
What would be a good workout or a good start so someone can get into weightlifting without, getting huge and not being that?
That's a good question. And that's a myth a lot of people have when they come in or start a gym program. Is I don't want to look like Arnold Schwarzenegger. You not believe how many times I've heard that from lovely ladies in my practice because I tell them to start lifting weights. You will not look like Arnold Schwarzenegger. There's a lot of people out there trying to look like him and can't get there. That's a myth. You can change the muscle metabolically, you can change its nerve firing rate, you can change its strength without ever changing its size. Size is related more to what crosses your lips.
Okay.
So weightlifting, I'd encourage people, if you're interested in it, find a good personal trainer. We have 6 great gyms in our little town. We have a number of excellent physical therapists that can help you. And I'd encourage you even go to your doctor and ask your doctor for a prescription to see a therapist for a wellness program or an exercise program. So you're trained properly. That's the only caveat I have with weightlifting, is that one slight move that's incorrect and you'll have an injury.
Right.
As you've experienced.
Yeah, I just dislocated my shoulder actually about a month ago lifting weights. So.
Yeah. Now that's not normal.
No, that was me, a bunch of different factors coming together.
Yeah. So I'd encourage people to get in the gym, move some weights, stay at home, get some soup cans, get a resistance band from Walmart, get a towel, have someone train you how to do it, and go for it. Your longevity is affected by your muscle mass.
When you say longevity, are we talking years of your life or decades of your life? What are we looking at here?
Years of your life and quality of life. And that was a big factor in that study I mentioned previously, is their qualities improve. So less falls, less fractures, cognition's improved, so less dementia or mental decline, for lack of better words. All those factors are benefited by muscle mass. Now, I should add, how do you measure your muscle mass? There's a number of very simple, cheap ways to do it. Bioelectrical impedance, skin calibers. Almost all the gyms in town have a way to measure it. We have a measure in our clinic, and so do other doctors' offices. Get your muscle mass measured, start exercising, lifting weights in particular, and again, make sure the diet's good.
Right.
And you are going to not only improve the quality, but quantity of your life.
All right. Well, thank you very much for stopping by this morning.